But anyway, any thoughts are more than welcome.
Introduce yourself.
I am Rajkumar. I'm very honored and pleased to be here. It is my singular pleasure to meet and interact with Professor Matthews on very few occasions, but those few occasions were so impactful in my life that it changed the way I began thinking about health, wellness, and cancers. My personal interest is in physical regeneration and longevity, but I realized that the distance between physical longevity and cancers is very close, and the same mechanism is in action there. And in the first meeting with Professor Matthews, he asked me the lifespan of human beings that I also shared here last time. Anyway, well, from a medical doctor's point of view, he made me go and...
She'll be here and she's going to take the last session. Anything anybody wants to share, you can share at this time. Anybody wants to share their experience? Nothing, no questions also. Maithili doctor, you going to come here? No, you're getting up. Okay, Srijit doctor.
Day of 2020, and so far I have spent, because I use a lot of mantras into it, such not just the Agnihotra mantra per se only. So I have spent more than 30,000 minutes with fire, making about 15 to 20 different mantras. I think that is one thing, sir, to answer your question, it is a game changer. Maybe it prevents a lot of unnecessary things happening to us, because fire is the only element that is not yet corrupted. We have water pollution, obviously land pollution, air is already gone, even the chem trails or the chem sprays in the Akasha is gone. So fire is the only thing that is not polluted yet, and most likely will never be polluted. It always has a Urdhva-gati. Fire transforms, fire destroys, fire is a refinery, whatever we can say about fire. And Agni is the main concept of at least Ayurveda. I imagine for Siddha system also, Agni is the main concept, or metabolism, you call it mitochondria, whatever you may say to that. So maybe this is one practice anyone can start doing any part of the world. It has no religious connotation to it, there's no religious aspect to it. Anyone who can believe or believes that sun is a powerful source of energy, they can just accept it irrespective of religion. So I think maybe that is something we can carry home in terms of possible prevention.
Last session, this is the last session of today's seminar. So let me introduce the speaker of this session. It is Dr. C P Mathew, who is the 7th generation Siddha doctor. Many of the Siddha doctors know Dr. Mathew because all the speakers of today's seminar, they are all seekers of knowledge. They don't be content in what they have. They would like to get more knowledge, try new methods for the betterment of the patients. So we were looking out for those doctors who are following the vision and mission of Dr. C P Mathew, sir. So we were very fortunate to have you, madam. God showed us that you are a person who is in the line of Dr. C P Mathew, sir. And when we invited her, she was very pleased. She was very much impressed of Dr. C P Mathew, sir's way of practicing his knowledge for the betterment of suffering cancer patients. So, Dr. Ventamare Selvi, she is the 7th generation practicing Siddha doctor. She is the daughter of very honorable doctor who is treating a lot of cancer patients. A lot of patients I have heard telling the name of her father. So she has a legacy also, I must say. And she currently is working as a cancer OPD in charge in Aranga Anna Government Siddha Hospital in Tamil Nadu. So with great respect, I would call upon Dr. C P Mathew Selvi for her speech.
First of all, I would like to thank the great soul, Dr. C P Mathew sir, the father of integrated Indian medicine, for giving us such a platform. Really, I feel it's a blessing to be in this place, in his place, during his anniversary. Last speaker, but not the least, because it's a very important topic in the treatment of cancer. I want to know how many medical people are here in this. Okay, quite a good number. See, everything starts with a prayer. கற்ற குருவாக்கும் காதலித்த வாகனமும் பற்றுபோல் ஒன்றே பரிகாரம். முற்ற அவன் பொறுப்பெல்லாம் ஒன்றும் ஆவதில்லை என்று இவன் உணர கீர்த்தி இங்கு. It means whatever knowledge we gain through literatures or through books or from Guru, these are all just an instrument. The miracle of healing happens only when the physician surrenders himself to the Almighty. Each and every doctor has to have the victim of terror in his mind before treating the patient, particularly the cancer patients. See, in Siddha, several centuries before, there are literary evidence for cancer. They have in Agastya Rananul, they have mentioned there are 100 types of cancer, and they have also mentioned about its treatment, both internal as well as external. See, they have used the word putru, sidalai, vipurdi, granthi, singi, karanai, turmagi, katti, kalalai, etc. to mention the abnormal, unwanted growth of these cells. See, Russia Aushadis are the best line of treatment recommended for cancer by our saints. They have suggested mercury, cinnabar, mercurous chloride, mercury chloride, mercury sulfide, sulfur and arsenic. Both for internal as well as external. We are talking about integration. First we must know the weapon which we are having in hand. Challenges which we are facing is, according to modern scientists, Western scientists, mercuries are considered to be a deadly toxin. But we want to integrate. Okay. The facts about marketed mercury. Mercury is highly toxic. It causes organ damage. It affects the brain and nervous system. It damages the kidney and nephrons, cause delirium and death. This is the fact known to the world by modern scientists. To be frank, our saints have registered more mercurial toxicity than the modern scientists. They have told gingivitis, neuritis, loss of sensory perception, severe headache, thirst, debility, delirium, liver damage, loss of memory, bleeding, etc. They had a very sound knowledge, unfathomable knowledge about the toxicity of mercury. See, and they have also given the antidote for mercurial toxicity. There are several antidotes they have mentioned, but this pepper barmuda grass concoction with butter is very effective. I have given to, see, 1 in 1,000 cases, anyone can develop a toxicity. In such case, we must know how to handle the treatment. Patient, we must know, because when the patient go to modern people, they will not be able to identify the cause. The skin will be peeling off, body temperature will be high. Only the physician who gave the medicine must know how to handle the toxicity of the drug also. That also our saints have documented. So before integration, see, we must be very clear about the modus operandi of the Western medicine as well as Ayush medicine. See, in Western medicine, step 1 is experiment. Phase 1 study, phase 2 study, phase 3 study. Then comes the observation. Based on the result, if it is satisfactory, they will formulate a medicine. Then the medicine will get launched in the society. After that, they will do phase 4 study where there is any side effects, contraindication. After the launch, they will do the phase 4. If the drug shows very adverse effect, then the drug will get banned. This is the procedure. mother is telling to the baby, this is your father. Baby starts calling Appa. Mother asking, you do DNA test and show me, then only I will agree. It's not like that. The same thing applied to Ayush system. The second comes the drug administration. The third comes the clinical observation. Last comes the R&D. See, in R&D, now many youngsters are concentrating in scientific paper presentation. Really, I feel very proud of that. The scientific studies reconfirms the revelations of our science are true. First step. The second one, none of the traditional Siddha drugs were proven harmful to mankind and then banned till date. This is the thing we must have in our mind. When we are interacting with allopathy or other system of doctors, when you tell about mercury, arsenic, they are harmful. See, their knowledge about that thing is very less. It is our responsibility to establish the mercurial and metallic metallurgy to the entire world. So, why the reason none of the drug, Ayush ASU drug is not able, we are not able to ban? What is the reason? See, several centuries before Saint has documented, we are preparing the medicine, we are giving the medicine. Now, not even a single drug we are able to ban. What is the reason? We have not done phase 1, phase 2, phase 3, phase 4 studies. The drug which has passed all the studies, they are banning the drug. But we want to follow that methodology. As the MLA in the morning he said, isn't it? We have to respect our science. We have to respect the uniqueness of our science. What is the reason? Why? Anyone? Why we are not able to? Because we are using all toxic substances, but it is found very safe. The reason is the Ayush drugs are not synthesized in laboratory. That is the first one thing you must understand. They are all given to the society for the welfare of the society as a revelation from our science at higher dimension. We have to accept it. We have to tell the world, this is the way, this is the modus operandi of our system. Okay. Next, regarding the treatment of Siddha in cancer, Theron has mentioned the 3 line of treatment. In that, heavenly treatment he suggests purple chanduram made up of mercury, sulfur and other things. Earthly treatment is herbs and herbal formulation. Demonic treatment is cytotoxic drug application on malignant tumor, plasters we used to call sealing, and fumigation, pugai, etc. The second one, in Aringarana hospital we are using this pugai, and other things. Catheterization soon we will execute in Anna hospital. They have suggested catheterization chuttilai for tongue cancer with copper instruments. Surgery, they had done surgery. In time we have lost the methodology. We have to rediscover. See, science are highly aware of the toxicity of mercury, but at the same time they have edified mercury as Lord Shiva, the primordial creation, wisdom, blessings, heavenly medicine, eternal knowledge, karpam, vindu, rasam. The first modus operandi is we have to believe our science. That is the thing. The most toxic, cytotoxic drugs are more effective in treatment of cancer. See, most important mercurial preparation for cancer, we can call it as Siddha natural chemotherapy. Because all the source, raw material, we are getting it from the nature. Nothing we are synthesizing. Okay. We use Rasagandhi Medical, Chandarasa Parpam, Idivalladi, Chandamaradu Chanduram, Nandi Medical, Gauri Chintamani, Rasa Chanduram, Sivanara Madam, Vishnu Chakramatre, God Medical, Panjasuda Medical, Rasa Medical, Gandhaka Sudar Tailam and Narayana Chakaradi Tailam. See, for external application, we use Amartha Vennai, Vellai Medical. Vellai Medical is highly toxic, which contains mercury chloride, Veeram. Cow's ear Kulambu Pugai. In Anna hospital OP, people It is a study done by me in IIT. That is, when mercury, marketed mercury is submitted to Suddhi using turmeric powder and this califor juice. What we found was the external study revealed that cadmium, lead were removed from mercury and the concentration of mercury got increased. The study was done in IIT Chennai. Second, the medicine prepared from the therapeutic mercury was found to be very safe. The Gauri Chintamani is one of the best medicine which is used in cancer. Science have suggested Gauri Chintamani for 10 types of cancer. Okay. Next, Valerasam. Siddhar had two methods to convert marketed mercury into therapeutic mercury. One thing is Suddhi. The other thing, they are great chemists. Straight away from the ore, they extracted mercury by using Plumbicus islandicum roots. The Plumbicus islandicum itself possesses anti-cancer activity. See, by the process of sublimation. This thing also we submitted to IIT. What we found was the concentration of mercury was very higher in the Valerasam. And we did the Gauri Chintamani, the medicine for cancer, using marketed mercury as sample 1. Sample 2 is the mercury which is undergone the process of Suddhi. Then the third sample, Valerasam. Using borax, the Gauri Chintamani contains just 3 elements, metals. One is mercury, the other is sulfur, the other is borax. All the 3 are submitted to purification. The sample 1, Gauri Chintamani, done with marketed mercury without submitting the process of Suddhi. Sulfur added is not submitted to Suddhi or borax is not submitted to Suddhi. As a raw, we did Gauri Chintamani and we did an animal study at Pallavaram, Wales College. Sample B, we used the therapeutic mercury, the mercury which was submitted to purification. The third sample, Gauri Chintamani, which we extracted from the ore, Chinnaba, using the mercury. The safety study revealed that first sample, the marketed mercury, the LD50 was 50 milligrams per kg body weight. The small dose when we administered the alpinolax died. Modern scientists are correct. They are talking about marketed mercury. That also we have proved, isn't it? But we don't use that mercury as such. When it is purified and medicine is added along with the adjuvant, if saint has documented 300 churnam with honey, give 300 churnam honey. Don't try your own hypothesis into that. Because they have tried everything in different dimension and given the best for the society. The second sample, the toxicity LD50 was 2000 milligram per kg body weight. The third, Valerasam, the LD50 was 2500 milligrams per kg body weight. See, it is clearly revealed that if we prepare mercurial preparation using Valerasam, the drug safety is very, very high. Toxicity is very less. We need not bother about that. See, the human dose recommended by our science are just 488 milligram for human body. 60 kg weight is 488. The safety level is 2500 milligram. Why should we bother about our drugs if it is prepared properly as per Shastras? Then comes the first half about the mercurial, the second is the gold preparation. We can call it as an immune therapy of Ayush system. the method of preparing tangam, making into foils. It has to be purified, then cut into fillings. See, according to their methodology, Tuvarai, Athi, Amanaka, Agatti, Valaikadi, 5 kind of herbal juices are being triturated and submitted to Pudam. If we start doing Tanga Parpam, one batch it will take more than 90 days to get the end product. See, this is the end product. All the Bhashmas will be in white, but gold will not be in white color. See, even I spoke to Dr. Anu regarding a case you can try Tanga Parpam. See, mental poverty is in our mind, in our Ayush doctor's mind. See, for a chemotherapy, for a radiation therapy, how much they are spending? They are spending in lakhs. They are selling their house and going for treatment. See, this Tanga Parpam costs somewhere around 12 to 13,000. But we can help the patient to come out of the pain. Longevity is good. His immune system is good. Even the death is very peaceful. That's the thing we can help the society. See, sir, Dr. Sendil sir spoke about a study in Concordia University about Tanga Parpam. This, my father's gold, Swarna Bhashma was tried there. The cell line study proved that it is very easily penetrating the cancer cells compared to other nanoparticle gold. If you want to know more about this, Google and see. Okay, see, in Anna Hospital we are seeing breast cancer, tongue cancer, anorectal cancer, liver, lung, brain tumor, multiple myeloma. These are some of the common cases which we are attending there. 5 pillars of Siddha cancer treatment. Allopathy has its own 5 pillars, isn't it? Ayush system must have our pillars in treating Siddha, treating cancer patients. First is the faith, because when we talk about cancer, I don't know about Kerala, what is the state, but in our state, they think conventional modern medicine alone is the treatment for cancer. They are programmed, patient is programmed in such a way, so that when patient come to our government hospital, first we will inculcate faith in their mind over body. When their mind is prepared to take the medicine, then only it will start working. And the prayer, what I used to tell all my patients, take the medicine, pray for 1 minute before taking the medicine every time, invoke the Almighty, that will bring result in you. See, this prayer and faith, I saw one miraculous thing as this oncologist who spoke today mentioned, isn't it? The patient coming to Anna Hospital, I see them for review, they are coming with smiling face. No crying, crawling, we are not seeing that. That thing itself, it's happening only by the higher power, nothing else, through prayers. Because we are giving them hope, these things can be experienced. With the experiments we cannot prove. Then we focus on diet. The patient, depending on the cancer, we suggest them to be a vegetarian and more of fibers. I ask them to consume more of soup, juice, because their quantity of consumption will be very less. We have to give power-packed food so that their immune system can fight against the disease. Greens, I recommend them plenty of greens. In Anna Hospital, we are giving Panchamutti Kanji, so that will help to increase their immune system. Then comes the pranayama. I used to know difficult process. I ask them to consciously sit, inhale and exhale. That's all. No difficult type of pranayama. That itself will help. But before 6 o'clock in the morning, when the ozone is very clear. Then last comes the medicine. Medicine is not the first thing to treat it. If we do the faith, prayer, diet and other things to the patient, their psychological well-being and physical well-being, everything is taken care of. Like ordinary disease, they are coming and taking medicine and going. Really, I am experiencing miracles, to be frank. See, in Anna Hospital, we sodium. Based on the affordability, we give this medicine. By the grace of science, results are amazing. Before starting the cancer OPD, I used to pray to Siddhar Agastya, Padinan Siddhar, stating that I am just an instrument in treating the patient. You take over. That's the truth. That's the truth. Observation what we found in cancer OP is when we treat them with metallic preparation, their dosage I used to dose it very high because I have seen my father giving Rasagandhi medical along with Mahamalladi Legium, everything it will be a higher dose because cancer cells need such kind of treatment. It increases the longevity of the patient, improves the daily quality of the life, reduce the severity of the disease, boost their immunity and control the spread of metastasis. These are the things which we are observing. See, just two cases I want to present here. I will do it fast. This is Martina Rajesh, 36 years. She suffered from brain tumor. That is anaplastic astrocytoma, stage 3. She went to Apollo. They did surgery, chemo, radiation, everything went on as per their protocol. After the surgery, she started getting epilepsy, frequent epilepsy. She is unable to speak. Okay, difficulty in swallowing and unable to walk. This was her situation post surgery. Then they went to Mia, one of the best hospital in Chennai. There when they did the MRI one year later, they found that the tumor has grown in centimeters. The finding shows that the tumor is somewhere 2 into 1.6 centimeters and 1.9 into 1.6 centimeters in the ventricle of the brain. Then again in Mia, doctor said you have to undergo surgery, then chemo and other things. But only 6 months they said we can support her to live, not more than that. The patient somehow came to know about Siddha and came for a consultation in private practice, and patient was dosed with the RGM, Rasagandhi medical, for more than a year continuously without drug holiday. We didn't give. Seeing the improvement, patient, the husband came, got the drug, he went. After 1 year when he came, literally he scolded him. How are you giving this medicine without a prescription? No madam, now she is able to talk, she is able to eat, she is able to stand with support. We have faith in this medicine. Then I changed the prescription with heavy metallic preparation like Idivalladi, Mahamalladi, Velvangaparpam, everything is high order of medicine. After 5 years, now she is alive. And okay, just coming for this conference, I asked them to take again the scan to see what is the status of the brain tumor. This is the last slide, but I didn't expect this result. It's a miracle. Completely the tumor has dissolved. It's a malignant tumor in the brain. Allopathy doctors has a lifespan of 6 months. Now 5 years, she is crossing 5 years. Even for the scan, patient did not cooperate. She doesn't want to go to hospital. I begged. I said I will pay the amount. I sent nurse from our clinic. In separate laboratory, we did the investigation. Now her husband is telling she is alive, she is okay, she is able to understand everything, she is speaking. If she is living with us, that's great. We will continue the medicine. Great modern medicine. After that, they went for chemo. Doctor suggested her 8 chemos, but she couldn't withstand the chemo. She came to Anna Hospital. This is the scan report after surgery, done after surgery, where there is residual lesion in the breast, along with a lymph node enlargement. 1, 2, 3 lymph node enlargement is there. For 3 years, she is taking no Tangaparpam or high order of medicine because in hospital it's not available. We are treating her with the RGM, Mahavalladi, Idivalladi, Amukura Churanam, things. No evidence of local recurrence, no evidence of lymph node metastasis or distant metastasis. See how much our Ayush drugs are supporting the patient. See, this is the testimonial. I want to read this just 1 minute. She undergone modified radical mastectomy in June 2019 in a private hospital in Chennai, and post that the doctor advised 8 cycle of chemotherapy. She was unable to take the chemotherapy because of the side effects of chemotherapy, and she became very weak. She discontinued the allopathy medicine completely and started taking Siddha medicine from January 2020 from Arina Ranna Government Hospital, Arumpakam. From January 2022 till date, she is only under Siddha medication and she has not taken any allopathy medicine. Post the advice of the doctor, we took a PET scan recently in August 2023 and the report shows no symptoms of malignancy. Our whole family is very happy. What we need more than that? The ultimate thing, the patient must be happy, isn't it? Integrated approach is paying way for better support, to extend support to the patient. First, we have to integrate among Ayush system itself, because Ayurveda is having something unique, Homeo is having something unique, everything is like an island. When we are able to integrate among ourselves, then it will be easy for us to integrate with the Western science. Okay? Any question? I am bound to answer.
Many patients with the breast cancer with metastasis in the bone or liver or brain have blood or...
Yes sir, yes sir. Not in the government hospital, because for the past 4 months only I am attending the cancer OPD in government hospital, but in private practice it is happening sir. But it happens with the support of Purna Chandrodayam, Thanga Parpam and other things sir. Completely metastasis is being dissolved.
That's very good.
Yes. Gold plays a very vital role.
5 years survival rate is only around 25,000 dollars.
Yes.
Just elaborate upon the Padangam you just mentioned upon Bale Rasam Padangam, I think so.
See, Bale Rasam is a process of extracting mercury from its ore Chinnaba. Bale Rasam itself is not a medicine. It is a pure form of therapeutic form of mercury which Siddha has recommended us. But how to make it is a very simple method. Powder the ore Chinnaba in the kalbam. Add equal quantity of root of Plumbago xylanica in a mud part. Just seal it with another seal. With the 7 seal they will tell, isn't it? Just cover it. By the process, heat it for 24 hours. By the process of sublimation, the mercury from Chinnaba get deposited in the inner part of the mud pot and cover. Very next day you can collect it with a brush. Okay.
Any other experience you had with Padangam types?
See,
With respect to cancer?
no, but not at.
Or any custom medicines?
See, I have not used Padangam or Katta till date. Maybe in future.
And Madam, what is the role of Siddha medicines in oral cancer? CA Bangal mucosa.
Yeah. See, in oral cancer, we are internally giving them Rasagandhi Medical. If it is in the form of medical, generally they are telling the dose as that of pepper and other things. But what we recommend is Sundaka Alavar, nearly 1 gram BD. That is the dose for oral cancer. And Vipurdi Thailam, we are using it for gargling. 5 ml of Vipurdi Thailam, we give it internally also for the patient. And Kausigar Kulambu Pukai is very effective. Kausigar Kulambu, just do you know what is Pukai fumigation? Oral fumigation with Kausigar Kulambu Pukai, very good result in oral cancer.
So,
with all the reports patients are coming, it may be stage 3 or stage 4. At that stage, our medicine is very effective. That in cachexia, Sir spoke about cachexia and cancer patient weight loss. In Siddha, there is wonderful medicine, Magavalladi Legium, made of semicarpus anacardium, that is anti-cancer property, as well as it is a herbal steroid. We combine, we give legium. Preferably in chronic cases, instead of Ashwagandha, we prefer Mahavalladi. When we put them on Mahavalladi, there will not be weight reduction. When patient is gaining weight, their self-confidence level will get boosted. Thank you.
So, I would request Dr. Marcos, our previous doctor in Charian Ashram. He was our doctor when Dr. C P Mathew sir passed away. He was taking care of the chelation therapy in Charian Ashram, but he was very humble enough to help us in our cancer OPD. He was a great believer in Dr. C P Mathew sir. So he is also joining in our seminar. I request you, sir, to hand over the memento of session to Dr. J P Ventamare. 2 seconds and 1/3. Okay? Shall we start from the first itself, right? Okay, so the first prize for the poster competition, poster presentation competition, goes to Dr. S. Vasantakumar. His poster was, the topic was Comparative Analysis of Siddha Medicines and Modern Medicine for Cancer Care, a comprehensive on prevention, treatment and post-treatment perspectives. Congratulations, Doctor. Requesting Dr. Ventamare for giving over the request A.J. Johnson to tell a word of thanks to all of you, and after that please don't leave without having tea and snacks. The tea and snacks is kept ready in the canteen. Please have tea and snacks and go back after the session. Thank you so much. Certificate, there's all those who have attended the seminar and those who have participated in the poster competition and the prize winners have their certificates. The certificate will be duly signed by Dr. Veena Kumari Madam from the NIS. So Senthil sir has taken it for signing. He'll be sending it back by courier, and once we get it, we'll be sending it by speed post to your college. Thank you.
Dear friends, we have come to the end of the session. It's a very wonderful session. I think everybody participated very successfully in this. And all scheduled programs were done on time and a very good mileage was given. So the last but not the least, I want to once again remind you about this inspiration of our Dr. C P Mathew. You see, who is the legend in the combination of integrated therapy, especially in cancer. See, Dr. C P Mathew, he has taught about more than 3,000, 4,000 students in 3 medical colleges. Now he is, Dr. Srijit was saying that he is still teaching, and his message in spirit is still teaching us. His presence also is very much felt here. So I would wish each and every practitioner here to take up the spirit of healing the people by offering the best service, best education and best means of choice of treatment. So here we wish to have sending our patients who are near to you to follow treatments, and if you wish to have the patients to be investigated, started treatments here, we can do so. And one thing more, what we did not mention here is the vitamin C therapy. That many of you, as we discussed yesterday about these 4 doctors here, we discussed in a very brief view that you can add vitamin C IV therapy in your place. Actually, I had a plan to give you all vitamin C while listening this program. Because one seminar we conducted in Ernakulam, about international doctors, about 60 persons gathering. Everybody was listening to talk while the IV was going on. I too took a vitamin C of 25 grams that time, and everybody shared the views. Unless you take it, you cannot feel the taste of that. And if anyone wishes to stay back tonight, tomorrow you can have a vitamin C and go. If you take out vitamin C, I told many times to Dr. Abhijit also, because unless you taste, because I take every once in a month, regularly. And Dr. Mathew was taking, even the last days, Dr. Saeed was, on slide was here, he was sitting next to him, vitamin C was going on the other hand, and he was looking at the patient. See, vitamin C is very, very highly proven now. That it can prevent cancer, it can cure cancer of whatever nature it is. Why don't we include vitamin C as well in our protocol? If you can get the help of any allopathy doctor, or if you can, there is no, it's not a must that you cannot do that. Nowadays, since the Ayush Ministry is taking all the steps to put you also in this track to give IV treatments also. So if you are interested, you share each other, giving one trip to your friend and get back to you. So like that, this is quite natural and quite, because our immunity is very much boosted. Because when in my experience and knowledge, I have seen lot of applications of antibiotics can be avoided by using this vitamin C. So if your patient is doing well, and we can make a contributive study, how many people got vitamin C. Now Dr. Shindo is using vitamin C media to put the chemo in. So if vitamin C can be included in this alternative therapy, it is a very valuable share of this meeting in your lifetime, that this is something which is shown excellent results. We have a friend, he's a doctor from America, staying in Ernakulam. He had a lymphoma. At the age of 72, he got lymphoma. Now he is 84. He is taking vitamin C in all forms, IV forms and liposuction and this powder and all nutrition supplements like CO210, alpha-lipoic acid and grapeseed extract, all these things, flaxseed, all nutrition supplements as well. In Siddha, there is plenty of nutrition supplements already there. So I wish that this comprehensive style of treating, because people who comes to you with confidence. So it is not expensive. It's very simple. So if you can take or include this sort of things also in your protocol, it will give more idea, more results for your patients, and you will also become more healthy to treat more patients. So coming back to what give you a word of thanks. So one and all, I don't want to extend more. Thank you very much for your coming participation, and I wish that, and I really feel that all of you are here, are well taken care and well fed, well cared, and thank you very much once again.